Peptides don't fix everything. It's not a fix.
What are peptides?
Peptides are amino acids which are normal in our body. Amino acids are the building blocks of proteins.
Have you had some cases of patients that took the wrong peptides and they had maybe side effects and they came to you to fix it?
A few of them, some of them had an hormonal imbalance after taking the peptides. We have to know who should take the peptides, when to take the peptides, how long to take the peptides, and from where do you get your peptides. When you source your peptides, you look at how are they prepared, what is the stability report. Peptides are for a reason and given for a particular reason for it, and the time span also should be a short.
There's a specific topic about longevity medicine that doesn't matter how many times you heard it, but I'm sure 100% that is not still clear in your mind. We're talking about peptides. And that's the reason why I invited today on the podcast Dr. Sajid. Hi, doctor.
Hi.
Thank you so much for being here.
No, thanks for being here. It's a pleasure.
Me too, actually. And Dr. Sajid will not only explain us exactly what peptides are, but also we're going to dive deep into longevity medicine together so we know exactly the details and what we should be aware of. Thank you so much for being with us.
Thank you.
First thing first, let's be clear with our audience about the term longevity. Everyone is using this term, can be anything, can be nothing. What's your definition of longevity medicine?
Well, longevity medicine has been misunderstood as, you can say, it's only anti-aging or anti-aging cosmetically, like just looking good or anything. But actually, longevity medicine is increasing your health span in the terms of being more mobile, being more cognitive, having a lot of energy, keeping your hormones in balance, and preventing any further illnesses. So it's like living longer but living healthier. So that's the misconception which usually people take.
Yeah. So I would say maybe prioritize also quality over quantity.
Yes.
Yeah.
Definitely, you can say that, yeah.
I assume, yeah. And doctor, is there a specific age where we should start being aware of, our age, or we should really focus on longevity in this sense?
Yeah, I mean, longevity, or what we say is aging, never occurs at it's always there. It does not happen when you're 50s or 40s or anything. It happens whenever. So I think if somebody wants to focus on their longevity, or what I could say their health span, you can start early. Like from 20s, you develop your reserves, you develop good muscle power, you good that. So that's a good building block if somebody starts early. Once you're in your 40s or 30s, you start getting those signals,
Yeah.
You'll see those hormonal balances, whether it's male or females. You will see your weight gains. You will see a lot of mental fatigue, or we could see a fog things. So these are signals. And at that time, we tend to improve or reverse them. And then once we cross 50s and 60s, it's preserving your functions. So I would say there's no particular age. The earlier you start, the better.
Okay, makes sense.
Yes.
And doctor, the reason why I really wanted to invite you over the podcast is because we are always trying to get the guests that can really give education and the right information to our audience, especially about wellness, because now everyone is talking about many topics related to wellness. And nowadays, I'm seeing that there are a lot of people that are trying to get into longevity and trying many gadgets or many protocols. But I also think that there's an awareness behind it. And what's the role of lab tests and protocols in this way? Yeah. I mean, is it so important to go solo and be independent when it comes to longevity, or it's necessary a background?
Well, I try to tend to, with all respect to the word wellness and all, I try to differentiate in the sense of wellness and longevity. Wellness is something when you feel good or something. You could use a lot of things like going to the gym, sleeping well, using a lot of biohack things. But those are the trial bases. You do this, you feel good, but it doesn't mean that underlying your biology, your body is also reacting to the same way.
You mean it's instant?
Yeah, it's an instant, or it's just a feeling. Okay. But what's happening into your biology or into your biomarkers is different. That's where longevity medicine focuses on. That we do your biomarkers or your blood test or whatever way it is. We know your biology. We focus on those areas and we improve it.
Yeah.
So there is an evidence-based shift, not just trial and error basis. And that's the difference, what I try to say, between wellness and longevity medicine.
Makes sense. So means that you're diving deeper into the bioindividuality of the person to see what is required for them.
Yes, like we say, longevity medicine is not about aging or not about the years you do it, but it's the projections, whether your biomarkers are going in the right direction.
Yeah.
So that's it. So you test it, you have an evidence, and you go ahead and do it.
Okay, makes sense. Um, Now the question that
Yeah.
everyone wants to know. There's a lot of buzz around it, but
Yes.
I really want to know, what are peptides?
Peptides are amino acids which are normal in our body. Amino acids are the building blocks of proteins. So from a few amino acids to more than around 50 to 100 amino acids together in different combinations make peptides.
Yeah.
So these are like communicators in your body or signaling in your body. They tell your body when to react, when to help you in your anti-inflammation or when to cause any problem, when to relax or when to communicate with other cells. So these are the communicators in your body,
So
the
would say they're
peptides.
kind of like activators. They activate a function in the body.
No, they communicate with them. They send the messengers over there. Yes, whether to activate or not to activate. So these are the messengers which will push it to
Okay.
activate.
Are there also like some peptides that can activate or communicate a missed signal in the body?
I mean, if you look at overall peptides, if they are not, there are a lot of peptides in the market. And if they are not done properly, they can miscommunicate. So if the peptides are not given under a proper guidance and just roughly taken up, it's not the right way. Like we have to know who should take the peptides, when to take the peptides, how long to take the peptides, and from where do you get your peptides.
Yeah.
These are the important questions we should know.
Why nowadays they're everywhere? Why they explode? They have been exploded now.
Longevity medicine focuses on three things, that is your recovery, you're reducing your inflammation, and the peptides exactly do the same things. So they fit in the way the medicine is going in those directions. And since we have the most, what I could say, a trend of our GLP-1s, which are Ozempic or Mounjaros, which are peptides.
Yeah.
So this thing has become more into it
Yeah.
and more talked about. So peptides have become more.
Makes sense.
Yes.
What do you think about those? The one that you mentioned.
They're perfect. In fact, GLP-1s will be one of my favorite ones because they help people to reduce their insulin resistance, improve their metabolic health. Also, it reduces inflammation in the long run. So I think they're great, but they should be given to the right person and at the right timings and for the length of time used.
Have you had some clients using GLP-1 in a right way, I would say?
Yeah, most of them. When we prescribe for them, we monitor them and they have to be taken in the right doses. The doses to be increased, their health should be monitored, whether they are losing fat, muscles, and they do really great.
Yeah.
Yeah.
Would you also recommend to a person that just want to lose weight, or would you only recommend to people that are they specifically have like maybe insulin resistance or they have other issues?
Well, weight gain or obesity is a complex thing. So we tend to understand what weight gain is the reason for it, and if they have they have tried a lot of other ways of losing weight,
Yeah.
because obesity itself is a problem, and it causes a lot of other medical conditions. So if they have not achieved to lose weight,
Yeah.
and if GLP is the one, yes, we do advise GLP ones for them.
Okay. Okay. Because nowadays they're very, I would say, available in the market, and I'm sure that, as you mentioned, people took them sometimes in a good way, sometimes in a bad way. So it's very important also to know like how to take that, and also to refer to a doctor the moment you really want to dive deep into this journey.
Yeah, because some people start with high doses, then they have their side effects. No, the way you take the dose, the site you take the dose, the timings you take the dose, what you eat along with your
Yeah.
peptides is also very important.
Okay, makes sense. And what are the biggest misconceptions that you heard about peptides nowadays?
The misconceptions about peptides was that peptides can fix everything.
Okay,
I
tell me
mean,
more.
when we talk somebody, I mean, I've got patients who come and then they've been going to the gym and the gym instructor says, oh, if they have the back pain or I have this pain, take this peptide. And a lot of clients, they buy their peptides online. So peptides don't fix everything. It's not a fix. It's not a replacement for your nature things. So that is the misconception should be taken out,
Yeah.
because peptides are for a reason and given for a particular reason for it, and the time span also should be a short and
Yeah.
specific.
I've seen so many people, especially in Dubai, because I feel that, peptides is a very innovative, I would say call it procedure, or I would call it like wellness longevity hack, I would say, as the city we're in, which is always about innovation. However, I've been seeing so many people prescribing peptides from, fitness centers, wellness centers, very random. And I'm sure that there must be a way where peptides are really like you can direct people to get peptides in specific centers. So it's not that me as a person I can recommend peptides if I don't have the knowledge and the background to just create a program to also support, as you said. So maybe another misconception is that they can be taken, very easily. Can be.
Well, peptides are not complicated if taken properly, but yes, they are not very regulated as medicines or things like that. So it's open market. You
Yeah.
get it online also or anyway. But I think the consumer has to understand that what the peptides are. If the peptides are not manufactured from a proper source, because peptides are very unstable molecules if they are not kept at the right temperature, especially the injectable peptides. What I'm talking about is if they're not kept at the right temperature, if they're not compounded or not prepared in the proper
Way.
pharmacy and kept at the storage, the transportation, everything, it makes the peptide unstable. So
Okay.
either they can harm you or they will be useless to take it.
Okay.
All right. And obviously, you have to take the right peptides. So that is very important from where you source your peptides. And when you source your peptides, you look at from how are they prepared, what is the stability report, what is the
Yeah. Makes sense. Okay. And a question comes in my mind right now. And what are maybe the side effects that peptides can create in the body if used in the wrong way?
yeah. See, the good part about peptides is if given rightly, they don't have major side effects.
Yeah.
But then they can work the opposite of the signaling, like they can hamper your hormonal balance the opposite way.
Okay.
They can increase your insulin resistance if it's not taken properly. Some of the peptides increase vascularization, so if somebody has a cancer, they can increase the cancer growth also. So identifying the right patient is very important.
Have you had like some cases of patients that they took the wrong peptides and they had maybe like side effects and they came to you to fix it?
Yes, we had a few of them. Some of them had an hormonal imbalance after taking the peptides. Some people definitely had joint pains and all. There was an increase in uric acid levels for them. So we definitely have,
So it's reversible in case.
yeah, peptides are like short, so they are reversible side
Okay.
effects. But then, yes, if they continue to take this and they ignore the side effects just for the effects of the side peptides, then yes, it comes to a stage which is irreversible.
Okay. So maybe let's say someone has developed side effects. The solution is just stop them, or you should recommend like a protocol to just detox from them, or
No, I mean the first step is to stop them
yeah.
definitely, and then we try to see what side effects is
Okay.
there, and then accordingly we do.
Okay.
Yes.
Okay, makes sense. What we should know about peptides that are absolutely an information that we can't miss. Now we talked about the misconceptions and some
Yes.
specific side effects. Something we really have to be proud of when it comes to peptides. A good information.
You have to be proud of.
Yeah?
Well, I think peptides are. I mean, they're good. Let me again rephrase it. I've been using peptides on myself and on my clients for a few years now, and then you see very good results. So I think in terms of signaling with less side effects, if they are doing, for example, if you have ligament tears or
Yeah.
injuries, you are somebody who's looking at balancing your hormonal levels instead of taking directly some hormones or testosterone, probably the peptides will help you to come to that stage.
Yeah.
So I think peptides used rightly are Wonderful.
What is peptides in specific that you really like and you think is will be very promising in the future that will change maybe like some health conditions or
Well, for now, the currently, which I can tell you, probably the GLP ones have done good.
yeah.
So I think people are taking it, and I've seen the change in the last 3 years, especially in Dubai. What we have seen, they have literally changed lives for people
Yeah.
in terms of improving their metabolic health, in terms of reducing their insulin resistance, their weight, the sugar levels. So I think that's promising. The newer ones, as you know, they we have to understand history of peptides. They've been there for a long 100 years. Insulin was the first peptide, or one of the peptides, which was it's more than 100 years, and the GLP ones. So they're already in the mainstream medicine.
Okay.
And slowly, once we have more approvals, we can say that they will be more promising and be in the mainstream of medicine.
That's a very promising,
Yes.
by the way, innovation. And that's why I was so curious and intrigued to talk about peptides because I've been seeing a lot of information going on internet and on social media. But before diving deep into the topic, I really wanted to have someone who can really explain me also because I'm new to this world and the audience about it in a proper way.
Right.
Yeah, because there's a lot of misconceptions.
There's a lot of misconceptions. There are a lot of peptides. Every month we see a new peptide or a new combination of amino acids coming up. But yes, they are still in the developing stages or still in the research phases. But once we understand the pathway and the biology and how what your body requires are, we
Yeah,
can give you the right peptide and help you.
yeah. By the way, are they all injectable, or there are certain peptides that you can take orally or
Well,
something else?
yeah, we have oral peptides, we have injectable peptides, we have nasal peptides. So peptides are pathways, amino acids taken in the body. The route of it depends on your what's available for you in pharmaceutical, and obviously, the subcutaneous injectant ones are more faster absorbed. They
Yeah,
directly into skin.
yeah,
Even the nasal ones are good enough.
yeah. And doctor, is there someone that really is not like we do not recommend them to touch peptides? A specific maybe case?
Yes. There's no specific because there are different peptides for different reasons.
Yeah,
Okay, but obviously the no for me would be somebody who's pregnant because we have no studies on it. Breastfeeding, I don't advise them for. I don't administer them to patients who have got an ongoing cancer because we don't know the progress of that. And also, I mean, I don't deal with children, so I avoid it in children. But yes, there are a lot of doctors who have given it to children, and we've seen improvements to them also.
okay, good to know.
Yeah.
Good to know. And I just want to also touch base the I would say another side of longevity, which you're personally curated, which is wellness travels. Because nowadays, I think the new trend is very focused on retreats or longevity clinics or everything that is connected to traveling to a specific destination, either to heal or restore your system or just continue your health journey. So why this came now and what do you think it's gonna go?
Well, uh, we all love to travel. I think that's our getaway when we are stressed out or something. We go on a holiday and we love to travel. And nowadays, why not combine that travel with more of a health
Yeah,
conscious? Why not just not come back relaxed from a holiday, but come back healthier from a holiday?
yeah,
So that's the trend which is happening. I've worked with a lot of retreats within the UAE and abroad and all, and we've seen there's a lot of demand on people who are looking out for taking care of their health while they travel, or they want to travel to destinations and get healthier and come back.
yeah,
So, and it's and I personally feel it's the best way because you're out of your stressful atmosphere. You are in a region where you get relaxed, your stress, your dopamine levels are lower,
yeah,
your state of mind and your body's biology is much more relaxed. And then when you do those tests, your biomarkers, and then you try to read them, you get the best response.
yeah,
So that's why this longevity travel is picking up. And fortunately, the whole world is recognizing it, and we see a lot of medical longevity retreats or centers coming up now.
yeah.
Yes.
As a longevity, can I call you longevity doctor, by the way?
Yeah, sure.
Yeah?
Yes.
As a longevity doctor, or a doctor specialized in longevity medicine, I would say, we talked about the innovation side of longevity, which is peptides, and a trend that is wellness travels. What do you think those two will go in the future, and where do you see the potential of them and the development?
Well, let me come to peptides. There's a
Yeah.
lot of development being made on peptides. The mainstream pharmaceutical companies are now trying to do more and more research on different kinds of peptides, and hopefully we will see better peptides which are already approved and come out in the mainstream medicine. So that we're looking ahead for that. In terms of longevity travels, yes, it is going to grow. People are going to love to travel because I think at a certain age people have traveled the world, but now they want to travel and be healthy also.
Yeah.
So why not travel, be healthy, maintain it, keep traveling, keep getting healthier, and imagine you traveling every year on year and getting younger and younger. So
Yeah.
that would be
Yeah.
great.
And last question for you before we're closing the episode. Is there a specific, let's call it trend, let's call it like, yeah, let's call it trend maybe, that you think is rising as you're a doctor that is into longevity and travels, and you have experienced many side of this field. Do you think there's like a prediction for the future? Where the wellness world will go? Is there a specific thing that you see it rising?
I mean, definitely over I think the last 5 to 10 years, we have seen. I mean, my background is in internal medicine and critical care, and I have been into both sides. I've seen active medicine. So from more an active medicine, we are becoming a more proactive medicine, and that approach is changing.
Yeah.
So in the whole medical world, we are being more proactive, more preventive care.
Yeah.
And we see going ahead, that is the way
Yeah.
medicine will work.
Yeah.
So we will try to prevent the diseases, we'll try to prevent the problems. And the whole longevity clinics or trends, that's going to be the future.
Do you think AI will be one of like a good ally for you?
Well, AI is definitely good, but like as you know, AI needs a lot of data and algorithms, and I see it still some time for it to take come into longevity because still a lot of studies,
Yeah.
a lot of growth is happening. So once the data is available, once we have more people involved
Yeah.
and taking care of themselves and using those longevity, so then AI can be.
Yeah, so you see the future of doctors like collaborate with AI the same way, so people can have available information, but that they can still go to doctors to have protocols and.
Well, AI is helpful. I mean, personally, as doctors, also, it helps us to do. We can just put in and get all the referrals we want. I mean, we wouldn't advise somebody some treatment unless we know everything about the
Yeah.
side effects of treatment. Also, we also have to study, and AI does help us to get all
Absolutely.
the collection. Yes.
Yeah, yeah. Okay, thank you so much, Doctor,
Welcome.
for being with us and to give us so much wisdom about longevity and peptides. And guys, I'll see you on the next episode. Please don't forget to subscribe, hit the thumbs up, and if you have any comments or any question for Doctor, please let us know. Thank you.